It's been about 8 months since our last event, and some of you may have wondered why we've had another one so soon. And I think part of that was following feedback from that event, because the period around February to March is often very busy for clinicians, meeting access targets, particularly in IAPT, and consequently not being able to attend external events. So we've moved this event to November, and certainly more of you have signed up to attend today, probably well over 100 as opposed to under 100. And so hopefully we've improved the timing. So we'll look at that and compare the feedback from today for the future as well. And I think also following our last event, those of you who are here, we collated the summary notes from the workshop, and I think I'd like to highlight some of the activities that the network has done. So those of you who saw Pete Carruthers' film Unload will remember what a moving experience it was and how it highlighted the context in which military veterans, in this example, can present to services and the need for psychological professionals to be able to respond effectively. And I think what I'm really pleased to report is it's been shown much more widely, but there's certainly work to be done in terms of making it more accessible. And I think the other thing that's been really, I suppose, innovative for us is that Pete's also engaged with the network to get feedback on his new play called Fantastic, which is also focused on mental health issues. And a small group of people attended a play reading in Bolton last month. And following on from this, there'll also be a play reading at Manchester University with medical, nursing, psychology students and trainees, and that'll have further input. I think that's actually happening tomorrow. I also think that's been a really useful collaboration where Pete's been able to gain feedback from professionals like ourselves around the accuracy of his depictions, but it's also been useful for us to see that mirror held up to ourselves and our fellow health professionals, and it can help us reflect on our work. We've also been looking at parity of esteem, ensuring that mental health and physical health are treated equally. The presentation by Claire and Lucy this afternoon will show what we've been doing so far and what our plans are, so I'm not going to preempt them. You should be seeing some of our new postcards and leaflets on our tables, and you'll hear a bit more about those later as well. I think also last time, for those of you here, Gregor Henderson from Public Health England provided a presentation on well-being, which I think in many ways has set the scene for today's event. And I think Gregor described for us the psychological and social contributions of public mental health and well-being and highlighted the work of the What Works programme, of which we'll hear more about later. And I think one of those areas, as Claire's already mentioned, to think about is well-being of our workforce, and we'll be hearing about that this morning too. At our last event, I talked about collective or systems leadership and the importance of developing a collaborative, shared approach, and how this resonates with our work, and that we listen, we seek to understand, enable, and empower the people with whom we work. Our skills as psychological professionals are consistent with this style, but I'm sure many of you have come across other styles of leadership on display which don't support this and perhaps can be a little bit difficult to deal with on occasion. Our environments also remain challenging to work in, and many of us will experience the R's. I did wonder about how many R's, but certainly of reorganisation and restructure and the potential consequences of these difficult times. I could whisper redundancy and rebanding, but let's try and avoid that. There's also then a challenge as to how we maintain our own well-being in these difficult times. Most of you, excuse me, will have a range of coping strategies and what you do to manage yourselves in difficult situations. But where do these coping styles come from? From our earliest experiences, we learn from the people around us, who are our primary caregivers. Most of you will be familiar with the principles of attachment theory and the impact of early experiences and how we grow and develop. Attachment theory has been widely written about in relation to a range of difficulties that people present with, including substance use, alcohol problems, psychosis, and so on. But what they all have in common is how our early experiences shape our lives, and from a clinical point of view, what we do to help that can have an impact for the better and how lives can be improved. The impact of adverse childhood experiences has also been widely documented, with poor outcomes in adult health and social outcomes. The increase in the numbers of adverse childhood events such as physical or sexual abuse, the use of illicit substances in parents or caregivers was associated with lower mental well-being, lower life satisfaction, being unemployed, poorer diets, respiratory and cardiovascular disease. So when bad things happen, they can have bad consequences, especially when they're part of our early experiences. But not everyone experiences poor outcomes, and it does suggest that overall people are resilient and can develop resilience. So what do we actually mean by resilience? The American Psychological Association defined it, and it's probably about as good a definition as any as I found, which was the process of adapting well in the face of adversity, trauma, tragedy, threats, or significant sources of stress, such as family and relationship problems, serious health problems, or workplace and financial stressors. It means bouncing back from difficult experiences. And I guess that's probably something you're all fairly familiar with. So how do we develop resilience for ourselves? And again, most of this won't be a surprise to us. Having caring and supportive relationships is seen as the most important aspect. The relationships that can develop and maintain our resilience have love and trust, encouragement and reassurance at their heart. Other things that are also important are the capacity to make plans and take steps to carry them out. Having a positive view of yourself and confidence in your own strengths and abilities. Having skills in communication and problem solving. And having the capacity to manage strong feelings and impulses. I think this probably again sounds quite familiar to us all as psychological professionals. And I think it's familiar to me in terms of the work I do within the field of post-traumatic stress. I work within a tertiary service, which usually means that people have experienced either more than one traumatic experience or may have had early experiences that have contributed to vulnerability to post-traumatic stress. Now, not everyone who experiences a traumatic event will experience post-traumatic stress, and many will display resilience. But for those who do seek help and receive it, the work often focuses on helping the person being able to manage the strong feelings often associated with a traumatic event and that have an impact in life generally. People often report feeling very anxious or very angry or very sad about the traumatic experiences they've had, amongst a range of other emotions. And also people who've experienced a traumatic event can have a negative view of themselves and their responses and their abilities to cope. And this is probably familiar again in the sense that you may have seen people who have said, well, it was my fault that that happened. It was something about me that made it wrong. So working with individuals to help them move forward includes helping them plan how to move forward and can include problem solving and communication. So again, our work in enabling and empowering people includes the development of resilience, and this is via a range of methods and styles in how we work. But thinking about resilience in the workplace, where it's perhaps become a more common concept, some of you will have observed the increase in training in resilience for staff, particularly those in management roles. And for example, one model of resilience highlights the importance of social support, adaptability, confidence, and purposefulness. I knew I'd have trouble saying that, which overlaps with what I've already mentioned. And I think training in resilience often includes cognitive behavioral techniques, communication styles, mindfulness, social support techniques, which again will be familiar to us. But I think often this training's either not offered nor taken up by psychological professionals. And it could be for a variety of reasons, including whether people are in management roles or not, and a perception of, well, you know all that anyway. And sometimes we're the ones who offer this type of input with mindfulness courses for staff, reflective conversations, or perhaps even some of the work I do in positive cognitive behavior therapy and imagery work with the Looking After Me, Looking After You program. But the importance of well-being in NHS staff's been highlighted by many people, and perhaps most recently, Simon Stevens, the head of NHS England, mentioned in early September at the Expo conference in Manchester. It was widely reported that Simon says we should have Zumba classes in the workplace, but I don't think he actually said those precise words. What he did say was he wanted to promote healthy eating options, fitness options, and mental health talking therapy services, which kind of covers our territory. So, how often do we apply our skills to ourselves and consider our own well-being in these challenging times? Earlier this year, there was a survey done by the New Savoy Partnership Conference in the British Psychological Society of around 850 psychological professionals across the country. And they found that 40% of the respondents reported feeling low in mood, and 42% reported feeling a failure, and that was for at least some of the time or more frequently. And some of the qualitative comments included feeling the pressure of targets and the availability of adequate supervision and CPD. Just as an aside, the survey's been repeated again this year, and we'll be circulating the links. So I'd really encourage you to complete the survey and report your experiences so that we can make those findings as representative as possible. A King's Fund survey also supported those findings, where lack of time was highlighted by about 30% of respondents, followed by a need to meet performance measures and measures of staff burnout and poor morale. The Chartered Institute of Personnel and Development survey, before that, reported that just under a quarter of healthcare workers reported feeling under excessive pressure every day, with 50% unhappy with their work-life balance. The British Association of Behavioural and Cognitive Psychotherapy also issued a press release warning of a bullying and coercive environment in psychological services. And finally, the UK Council for Psychotherapy and also the British Association for Counselling and Psychotherapy reported that caseloads were increasing and time for reflective practice decreasing, and over half of the respondents early this year reported a reduction in service provision and a reduction in higher banded posts. And I think some of that will be familiar to us in terms of where we sit. But given this background, what can we do? I do think we need to consider our own psychological well-being and how we look after ourselves and each other. We've evidence of what works, and we'll be hearing about that this morning. We also have the skills to make a difference to others, and we should be making a difference to ourselves. Anecdotally, I heard from a service user lead that she'd been hearing about service user concerns about the stress levels they perceived in their therapists. Now, while we do promote co-production, it's not one that we'd apply in the clinical setting directly. And it is important that our own issues don't get in the way of the work we do with our patients, clients, service users. And I think another example of how we do and do not support each other was during Looking After Me, Looking After You training session I delivered, where 3 of the health visitors who attended described how their team met once a month for breakfast to catch up with each other. There were 2 nurses from a community mental health team there also, who said, well, we just don't have time for that. And I guess while that's just one example, it's worth reflecting where we sit on that divide. So when was the last time you took time to have a conversation with a colleague that was more than a transaction about something that needed to be done? Maybe you're better at it than I am. We'll hear more this morning about Schwartz rounds as a way of developing reflection on the impact of the work that we do. And another aspect of resilience is social support, or communities that provide cultural support and also positive support. And I hope that the Psychological Professions Network also contributes to this for us. The growth of the PPN over the past 18 months has been amazing. I think we now have over 1,500 members. And I think it's a testament to the contribution of the PPN, but also to you as members of the PPN who've contributed your enthusiasm, time, and energy to making this a positive and successful community. And a recent conversation with colleagues who were at the beginning of the journey reflected on the PPN and what it brings. And I'd like to mention 2 things. Being part of a wider community is really important, or in another way, as someone put it, the more the merrier. And I think that's true. Sometimes that will help us deal with the isolation. The other comment was having faith in the value of what we offer. And I think sustaining the faith in what we offer in these challenging times is supported by having a community that supports us. How easy is it always to say that, well, actually psychological interventions, talking therapies are important, when we're saying, well, do we actually really need that? Or can't you do it cheaper? It's quite, if you have someone behind you to say, well, actually, there's a whole lot of people that also say this, they can help me with that message. So growing our community and building those relationships widely is also important. And looking outwards at how we can engage and influence the wider world is one of our key tasks. But more of that this afternoon. in terms of the work we've done so far. So I'd like to finish by inviting you to consider, I suppose, a more holistic approach this morning during the presentations. So I think it's not just about thinking what the presentations we'll hear means for the work that you do, but also how it applies to you and me and what you can make better for yourself. It may be that you're already doing this, but I guess I believe that there's always some scope to learn. And I think my example of this is perhaps one some of you may have heard before. A client I saw who presented with symptoms of post-traumatic stress described struggling to get to sleep, and we talked about what might help. And she said she focused on the things she hadn't achieved when she was lying in bed, and this kept her awake. So we agreed that perhaps she could try focusing on the things she had achieved on the day instead. So next appointment, 2 weeks later, I asked her how she'd found this, and she said, it's brilliant. Sleep had improved, she felt a lot better. So I reflected that perhaps I should try this too on those days when things can get on top of you and the emails pile up and you haven't answered most of them. And I'm pleased to report that it does work for me too. So thank you very much.